And we're going to go to the next exercise. Okay, we're going to go to the plank position now. The beginning plank is the position that Beth is in right now. She has her head down in neutral, and everything is sort of lined up from her ear, shoulder, hip, and knee. So basically, she's in neutral. And again, these exercises are from easiest to hardest, so, but it doesn't always match that rule, okay? So anyway, she's on, her shoulders are directly above her elbow, and so what she's going to do is she just holds that position for however long she can do it. We want to, if she can do this for a minute or even 2 minutes, then we would progress it to the next level. And the next level would be to actually extend the hip without influencing the spine from the head down to the tailbone. You do not want anything to move. And then she'd basically alternate, do the other side, like certain 5 to 10 times. And her abs are braced or tight. And that is the hip extension with the knees bent. Now we're going to do it with the legs straight and then toes on the ground. Just lower that down a little bit. Beautiful. Head down. And she's in a neutral position in her neck, or what we call axial extension, or a chin tuck. So if I took her ear, shoulder, hip, knee, and ankle are all in a straight line, and that, again, you hold that. Again, just move your shoulders, just rock them forward a little bit forward, so yeah, the other way, yep. So now your shoulders are directly above your elbows. That's perfect form, looks excellent. So we try to hold that for a minute. If you're doing it 2 minutes, you're doing an excellent ab workout there. Again, she's holding her abs in tight. She's in neutral, like we talked about. Now she's going to lift up one leg without influencing her spine. So again, you can lift it up as high as you can, but sometimes people lift it up too high and their back extends. Lift it up a little high. Yeah. We don't want to see that extension of the spine. You want to, or arching of the spine. And then she'd do a few reps that side, she'd do the other side, and she's keeping a nice neutral spine, looking straight down. And that is the plank on elbows and toes. Now we're going to have a expert roller roll the stability ball right to Beth, right from nowhere here. And now she's going to actually do a plank with her elbows on the ball and her toes on the mat. And she holds that for a given amount of time. Again, once you can hold these postures for more than a minute, up to 2 minutes, it's time to move on to a more difficult posture. Okay? Again, her ear, shoulder, I'm just going to have you look down a little bit more, Beth. Yeah, her ear, shoulder, hip, knee, and ankle are all forming a straight line. Her shoulders are directly above her elbows. It's an unstable surface, that stability ball. Now, if she wants, she could make this harder by actually bringing one knee up toward the ball and then bringing it back, and then the other knee. So we're calling this plank on the stability ball with alternating hip flexion. And that's difficult, and we're going to stop there, and we're going to move on to the next exercise. Okay, a lot of times in the abdominal world and in the gym world, we tend to move only in one plane. This is the first of, we're working a different plane. We call it the frontal plane. Basically all it is that you're basically doing an exercise that's working the sides, or what we call the lateral subsystem in this industry. But basically what I want to show is something that people do, and I did it for many years. I did it wrong. I want you to just sag now, like that, and now just lift your hips up. Just lift them right off the ground and come down and sag. That can put damage to your lumbar spine, especially if you're an acute patient in back pain. So we don't want to do that. What we want to do is, I'm going to bring my camera so you can see this. And so don't mind if it's amateuristic, but basically I want you to see, come down now towards your heels, Beth. Bring down towards your heel, and now come back up. So you're thrusting forward. That's how we do that bridge. Come back, Come down. So it's almost like, for you fitness people out there, it's almost like a sagittal plane squat. She's moving in a direction where she's almost like doing a squat, but she's coming back up, and then she holds. Now, the hold time is depending upon the individual. And then you come back down again. So you might want to start with 5-second holds, then work up to 10-second holds, and then 15, finally up to maybe a minute or 2 minutes is my cutoff point. And then we would move to the next exercise.